Councillor Hawken, Councillor Nolan, the live stream is live. You can start the briefing.
Thank you very much, Sarah. Welcome members to the sixth in a series of public-facing all-member briefings reviewing progress made in delivering the Council's Healthy Cornwall priority. As I hope you'll know, I'm Councillor Rob Nolan, Portfolio Holder for Environment and Public Protection, and this presentation will be a double act with Councillor Sally Hawken, Portfolio Holder for Children, Wellbeing and Public Health. We'll be talking to you today about the public health and community safety element of our Healthy Cornwall priority, which extends across both our portfolios. For any residents who are joining us online, the Council agreed the priorities for Cornwall at the start of the current administration back in June 2017, a month after the last council elections. We have remained focused on their delivery over the past 4 years. As we count down to the next council elections in May, it feels appropriate to take a moment to reflect on how far we've come in delivering on the commitments we made to the people of Cornwall. That is why these briefings are public facing, so I would like to extend a warm welcome to any viewers from outside the council who may be watching or listening. In addition to reporting on progress on each of the priorities, these sessions will also reflect on the impact of the pandemic and the opportunities that we need to grasp to help to deliver our new 2050 Cornwall Plan, together with some of the more immediate steps being taken in the 2021-22 budget. When setting the priorities, the 5 priorities for Cornwall 4 years ago, we listened to our residents who told us that local health services are their top priority for Cornwall. We know that good health is about more than local health services. It's about our lifestyles, environment and homes. It's also about feeling safe in our communities. Public health and community safety underpin much of Healthy Cornwall priority, and we agreed the 4 focused aims. Our priorities: deliver better health outcomes for everyone, protect children's physical and mental health, reduce child poverty, increase the number of people taking outdoor physical activity. We also agreed a number of measures that would define our success. Reduce the number of people staying in hospital longer than they need to because of delays in providing care. Increase the proportion of working-aged adults with a learning disability in paid employment. Reduce the need for admissions to care homes for older people and younger adults with disabilities. Increase the number of disadvantaged young people in Cornwall who achieve a good GCSE pass in maths and English, compared with all young people in England, and reduce the number of children living in poverty whose families benefit from our service. I'll pass you over to Sally.
So hopefully, I'm just looking to see whether, yes, you can see the timeline that I'm looking at, good. This timeline captures just a small number of the Council's achievements since 2017, starting with the innovative We Are With You community drug and alcohol services for adults and young people. These services are worth over £5.5 million and are rated by the Care Quality Commission as outstanding for responsiveness. More recently, our pandemic response has gone above and beyond the National Test and Trace programme. We are one of the first areas in the country to begin case review services used to such great effect when following up on the Pilgrim Pride outbreak. We set up drive-through flu vaccination centres at Stithians Showground, Eden Project, Royal Cornwall Showground and the China Fleet Country Club in Saltash. And we've launched a rapid community testing programme, testing people without COVID-19 symptoms to help reduce transmission of coronavirus based on our knowledge that around 1 in 3 people with COVID-19 have no symptoms, so could be unwittingly spreading the disease. The Council has delivered many more initiatives which range in size and scale, but all of them have contributed towards a healthy Cornwall. Rob and I will highlight some of these in more detail in a moment, but we're really proud of what the Council has delivered since 2017, and we want to pay credit to Council officers and our partners, NHS Kernow, Devon and Cornwall Police, Devon and Cornwall Probation Trust, Dorset, Devon and Cornwall Community Rehabilitation Company, Cornwall Fire and Rescue Service, and the voluntary and community sector in Cornwall. We have responded to our community's multiple differing needs during the pandemic. To take one of the examples I'm proud of, we have partnered with DWP to create a bespoke service supporting people struggling with mental health and other complex barriers that prevent them from working. Based in job centres, the service offers personalised mental health support leading to volunteering and employment. Mental health first aid training has also been delivered virtually, as well as virtual lifestyle assessments, and we're reaching out to all of our communities. Our fishing communities are benefiting from improved health and wellbeing through the CFIT programme, delivered by the Council's Healthy Lifestyle Advisor. NHS health checks have been delivered at Quayside in Newquay, Hale, Cadworth, Newquay, Padstow, Looe and Mevagissey. We have helped people to stop smoking, eat healthily and get active to improve their health outcomes and make healthy choices for their lives. Good maternal health is supported through Healthy Start, and child excess weight is being tackled through the Council's support in early years settings and the Healthy Under 5s programme. And we're tackling smoking through many initiatives. This is so important because in 2017, Cornwall had higher rates of smoking than the national average amongst adults, pregnant women and manual workers, causing almost 1,000 deaths each year and costing an estimated 24.9 million to the NHS in Cornwall. So we launched 10 smoke-free play parks in areas of deprivation in Penzance, St Austell, Looe, Liscard, Launceston, Newquay, Logan, Hale and Bodmin. We seized illegal tobacco by joining up our public health and trading standards teams, resulting in over 7 years of lives saved since 2017. That's based on the British Medical Journal evidence that every cigarette smoked shortens a smoker's life by 11 minutes. I'm really proud of what the Council has achieved over the past 4 years, a 20% increase in people stopping smoking between 2017 and 2021.
Right across Cornwall, we are working in partnership to make Cornwall a safer place to live, tackling antisocial behaviour and street drinking, helping the most complex users of alcohol and other drugs, training 4,000 people to identify risks and intervene early in drugs, alcohol and mental health issues, adapting services during the pandemic to enable new virtual delivery methods and online classrooms. We are supporting our communities who are worried about reduced police visibility and not knowing where to find help. So we provided a new community safety toolkit to promote the support available in all communities across Cornwall. We've also developed Z cards with a quick reference directory of key services and the best ways to report concerns on ASB, crime-related issues, rough sleeping and discarded needles. Our hospital outreach pilot illustrated how partnership working can successfully help vulnerable people who frequently use emergency health services due to problematic alcohol and/or drug use. This helped inform the government's decision to expand alcohol care teams to 50 hospitals across the country as part of the 10-year NHS plan. Cornwall leads the way nationally in saving lives with naloxone, an emergency antidote reversing the life-threatening effects of an opiate overdose. Naloxone was introduced into complex needs supported housing and outreach services and is now being expanded to include community outreach and domestic abuse residential services. We have commissioned an integrated domestic abuse and sexual violence service, bringing 14 contracts to one provider within a national partnership, First Light and Barnardo's, to increase public confidence. In the last 12 months, the service has supported 4,900 people and their families experiencing abuse. We wanted to highlight 4 specific achievements that link directly back to our original aims and success measures. We're going to spend the next few minutes focusing on fit for and during pregnancy, help for young people experiencing difficulties with emotional, social and mental health, rapid response for complex town centre antisocial behaviour, and intelligence-led community safety partnerships. You're on mute, Sally.
Thank you. I was doing so well as well. Fit for and during pregnancy. The Healthy Pregnancy at Scanning initiative is a pioneering approach supporting, empowering and motivating families to lead healthier lives. It was recognised in the local government association's Fit for and During Pregnancy, in which our maternal health team featured as a good practice case study highlighting the importance of a healthy weight. Through innovative partnership working, health improvement and prevention has been embedded into our local maternity system. The partnership with Royal Cornwall Hospital Treliske is a shining example of good practice across the region, with the team presenting their work at 3 regional conferences and reaching the finals in the MJ Local Government Achievements Award in Public Health Improvement. Following the introduction of the Healthy Pregnancy at Scanning programme in June 2018, the Healthy Cornwall Maternal Health Team has supported over 1,600 pregnant women and 1,400 partners up until March 2019. The Healthy Pregnancy at Scanning initiative fulfills the Healthy Cornwall priority and its aim to promote children's physical and mental health. Our collaboration with NHS maternity services delivers the Council's strategic objective of better health outcomes for everyone, working with partners to shape our future health and care services, as well as the local maternity transformation objective to reduce stillbirth and perinatal death. The pioneering approach has supported, empowered and motivated families in Cornwall to lead healthier lives, reaching more women through the support service and their partners by promoting the importance of their role in pregnancy health improvement. It has also helped low-income families find support through Healthy Start. Moving on to our second flagship initiative, Help for Young People Experiencing Difficulties with Emotional, Social and Mental Health. We know that early intervention for young people experiencing difficulties with their emotional, social or mental well-being is crucial. This ensures they get the right help as quickly as possible, especially in the current climate with the challenges of lockdown, such as reduced access to education and extracurricular activities, which are so important for development, and only limited contact with their peers and teachers. Working collaboratively and in partnership with CAMS and Head Start Carno, we have rolled out an early intervention programme called Bloom across Cornwall from an initial pilot in Penwith. We've successfully established the model within each of the 6 localities in Cornwall. Bloom is an early intervention consultation model for professionals working with young people. Within each Bloom consultation meeting, professionals such as GPs, teachers, social workers, family workers and community workers meet with a CAMS clinical psychologist and a primary mental health worker to carefully discuss each young person's presentation and needs and consider how the young person might best be supported. The multi-agency forum reduces the time it takes for young people who are often vulnerable and with complicated needs to get the support they need and get it right first time. Professionals involved in the programme are enthusiastic about the results and have highlighted how good it is to get everyone together to determine what is in the best interests of the child or young person, rather than individually contacting different agencies. Bloom meetings are currently being delivered via online in East, Mid and West. Pre-COVID, Bloom meetings were held weekly in each of the 6 localities within Cornwall. From January 2019 to December 2020, Bloom has discussed 520 referrals for young people.
Next, I'd like to tell you about our rapid response for complex town centre antisocial behaviour. Across Cornwall, our towns are experiencing increased levels of antisocial behaviour, alcohol and drug-related problems. Whilst these are not new issues, COVID-19 has made it an incredibly difficult time for many, and more so for the most vulnerable people in our community. Local issues often involve groups of both adults and young people which can lead to a significant crossover with other high-risk challenges, such as exploitation, problem drinking and drug use, and county lines drug trafficking. This surge in demand across multiple towns has placed significant pressure on our services, particularly outreach and community safety services. The network of safer town partnerships established in 10 key towns across Cornwall has enabled organisations to set up local support and mobilise resources quickly and efficiently when problems arise. These partnerships directly involve local people and community groups in looking at local problems, encouraging a strong sense of ownership for nearby issues and a vibrant problem-solving approach. In St Austell, there were serious concerns about antisocial behaviour, drug litter and open drug use taking place. Due to our partnership approach, Safer St Austell coordinated an intensive 6-week multi-agency response plan to tackle the issues which reduced antisocial behaviour and better supported vulnerable people through improved coordination of support and housing. Members of the public and businesses reported a notable reduction in antisocial behaviour. We have made a real difference to our communities to ensure they feel safer where they live and work, responding quickly by coordinating extra patrols and ASB drop-ins, public reassurance and communications and outreach support, drug-related litter response, civil parking enforcement and community protection action to reduce littering, dog fouling, fly tipping, and removing abandoned vehicles in response to 2,000 complaints. CCTV use and facilitating dynamic sharing of information and management of risk. Safe Towns have held a range of extra diversionary activities for young people, many of them co-designed with local young people themselves, alongside building skills and confidence and raising awareness about the risks facing young people in Cornwall today. Building and learning from this approach, we are now testing a new whole system way of working that brings together local plans for economic development with those for improving outcomes for vulnerable people and achieving a safer community for everyone. If successful, this will provide a blueprint to help us develop longer-term solutions in other towns. The final standout achievement I'd like to mention today are our intelligence-led community safety partnerships. In our community safety team, we have an established and experienced intelligence function, Amethyst, enabling effective use of multi-agency evidence to understand and respond to needs and evaluating impact. This helps us to bring additional external funding into Cornwall through bids supported by high-level intelligence, evidence of need in the local population, and a robust evidencing of the impact of investment. An example of this is the recent £840,000 award from the National Rough Sleeper Alcohol and Drugs Grant. A bid was submitted by the pioneering Joint Commissioning System Organisation Group, who design and commission services in a joined-up way across Cornwall, improving the whole system response to meeting the needs of people with multiple vulnerabilities. People with complex needs have historically fallen through the gaps due to a lack of shared, coordinated approach to service delivery. We are determined that no one in Cornwall should be left behind. Because of our renowned intelligence function, Safer Cornwall now leads on the national programme for developing the accredited MORILE risk assessment process for community safety partnerships across the country. We have produced the first MORILE-based Peninsular Strategic Assessment, which has underpinned the refresh of the Police and Crime Plan. We continue to lead the way in better decision-making for the people of Cornwall, ensuring services we commission are tailored to our community's needs. At the same time, we have received national recognition. The Safer Cornwall Intelligence Team was commended for the development of an innovative health impact licensing tool now embedded in our 5-year licensing policy. The tool uses health data to build a much more comprehensive picture of local alcohol impacts so that we know where to target our services.
Moving on, we wanted to provide a couple of examples of how, through this priority, the Council has lived the values agreed in 2017, namely, we listen, we are responsible, we act in the best interests of Cornwall. The 2017 resident survey revealed that only 31% of Cornwall's population agreed that the Council was making the area a better place to live, which was heard loud and clear. The Council responded, and our commitment to make Cornwall a better place to live is embedded within the services we've already talked about today that fulfil the Healthy Cornwall priority. Since 2017, the Council has ensured that health inequalities across Cornwall are tackled. In Cornwall, our housing stock is old and cold housing is widespread. 12.6% of households in Cornwall are in fuel poverty. Fuel poverty is a long-standing health issue. The impact of cold housing on health and the stresses brought on by living in fuel poverty. COVID-19 stay-at-home lockdowns have further highlighted the importance of a safe, warm home on health and well-being. Public health is tackling fuel poverty through interventions which improves health, reduces inequalities, and reduces demand on the healthcare system. Since 2017, over 3,500 homes have been improved. 660 homes have been fitted with first-time central heating, with a further 509 due to complete by March 2021. This work includes 50 park homes at St Clum being connected to Maine's gas network for the first time. In 2021, the percentage of residents agreeing the Council is making Cornwall a better place to live increased by 24%. 90% of residents are satisfied with their local area as a place to live.
Since 2017, the Council has worked hard to improve safety in the community. Back in 2017, only 31% of residents agreed that the Council was working to make their areas safer. In 2018, a dedicated antisocial behaviour casework was in post for the first time in Penzance to tackle ongoing concerns in the town centre relating to antisocial behaviour and street drinking. Since then, the reported levels of ASB have reduced by 40% and public confidence has increased. 60% of residents say that things have improved, and in the most recent resident survey, 54% agreed that the Council is working to make the area safer. This is an increase since 2017 of 23%.
Turning now to the impact of the pandemic on this priority. Poverty as one of the wider determinants of health has become an important priority for public health. One of the biggest concerns from the pandemic is the risk of job losses, poverty, and the negative impact of poverty on health, particularly child health. Locally, Cornwall Council has seen the number of children eligible for free school meals increase by more than 2,000 since the start of the pandemic. A survey from early in the pandemic showed that 37% of local food banks had seen a 50% increase in demand since the start of lockdown. For children and young people, it has been a very disruptive year, with several schools in Cornwall having to isolate their students, limited extracurricular activities, uncertainty about exams and youth unemployment, adding up to a potential lost COVID generation. Since the pandemic, we have worked to protect public health and reduce the health impact of the pandemic. We have raised awareness and delivered mental health and suicide prevention training available for our communities in education settings and the professional workforce. We were one of the fastest in the UK to be up and running with a digital offer, mental health first aid, once lockdown started. And we established a new financial advice and mental wellbeing service run by local voluntary sector organisations. We've developed social media alternatives to face-to-face services and addressed digital inequalities to ensure health improvement continues, such as weight management and smoking cessation. In fact, we adapted smoking cessation support to virtual delivery as a priority service as COVID-19 affects the lungs. We held a virtual conference to implement personal, social, health and economic developments in education settings to help pupils develop the knowledge, skills and attributes they need to manage their lives, which has even greater significance in these challenging times.
The underlying factors of poor health are the same factors that increase the risk of crime: poverty, vulnerability, unemployment and low education levels. This reinforces how important it is to have a joined-up partnership approach. The most critical underlying factors include the increased levels of antisocial behaviour and problems with street drinking and drugs experienced by many of our towns. For some of our most vulnerable residents, food insecurity, debt, housing risk, together with substantial changes to daily life, have increased isolation and heightened the risks of harm, abuse and exploitation. More individuals and families are in temporary accommodation, having to live in poor conditions or become homeless, adding to the challenge of trying to support people with complex and multiple needs. At the same time, perpetrators have sought to take advantage of people's increased vulnerability and changed behaviours, so as increasing activity online and expanding covert networks. The nationwide move into lockdown conditions tested the agility of community safety and wider Safer Cornwall partnership to respond under unprecedented circumstances. We responded with stepped up local support in our Safer Towns partnership, sharing information about the rapidly changing nature of crime and the risk across each area, a dedicated COVID enforcement and business support team who have worked with internal and external partners to respond to over 7,000 COVID-related service requests and delivered 38 business webinars with 3,000 registered businesses attending to ensure people and businesses followed the government guidance. Intensive support within the first week of lockdown for vulnerable people with complex needs, people dependent on drug and alcohol and rough sleepers. Responses were rapid and creative to reduce risk of harm and delivered at a scale. For example, every one of our almost 2,600 patients were reviewed and risk assessed to ensure continued safe access to prescribed medication during the initial period of pharmacy closures. Face-to-face outreach support was increased for those most at risk. Commission services quickly established web chat, Skype and other support options to maintain client contact and safety. And in the first weeks of lockdown, in the first weeks of lockdown 1, Safer Cornwall launched a public domestic abuse campaign that included safety tips and covert apps. These messages have been reinforced at each lockdown.
The Cornwall We Want listening exercise was launched in June 2020 to capture the way residents felt about the massive changes to our way of life during the pandemic and how they wanted to shape Cornwall as we recover. The resounding feedback was a fairer, more inclusive and compassionate Cornwall. Many contributors celebrated the local culture and community spirit. Some reflected on how the pandemic had brought communities closer together and wished this to continue, and that caring for neighbours should be part of the new normal, while others highlighted tensions and called for an end to racism in Cornwall. Some highlighted the unequal impacts of the pandemic. Disproportionate effects on some communities are a concern, particularly for the elderly, disabled, homeless, and people with mental health issues. Our engagement with young people highlighted concerns about mental health support. The number of people identifying as having depression and anxiety has doubled since 2017. This provides a clear mandate for the council and partners to work together towards safe, healthy and resilient communities. And that is precisely why we developed our new Cornwall Plan for 2050.
Safe, healthy and resilient communities is one of the core transitions of the 2050 vision. Together we can, the Cornwall Plan. The plan sets out our bold aspirations for Cornwall in the decades to come. In 2050, no one in Cornwall feels lonely, and people live well for longer, enjoying good health for at least 5 extra years of their life. Cornwall is the safest place in the country, and compassionate communities are helping each other to live, learn and age well. The Safe, Healthy, Resilient Communities priority has started to deliver the Safer Cornwall Vision and Safer Cornwall Partnership Plan, and contributes to the overall drive to improve health and well-being, reduce inequalities and protect the local economy, community life and the environment. In particular, there is a shared commitment to reduce violence in communities, and this will put Cornwall in a good position when the new serious violence duty comes into force. The government is changing the law to make it a legal requirement for public bodies such as the police, local councils, town and parish councils, local health bodies, education representatives and youth offending services to work together to address the root causes of serious violence. This duty will be discharged through community safety partnerships.
Sorry, Rob, you didn't need me having a technical problem then. I am nearly there. I just lost everything, but
Do you want me to finish off?
we're on the draft budget, aren't we? I
Yep.
think I found it, yes. Sorry. Our draft budget proposals for 2020, 22 will see Cornwall taking a number of steps towards delivering the Cornwall Plan and this core transition by focusing on reducing health inequalities that have been highlighted by the COVID pandemic. We'll build on our strengths and work with specific communities and places with the greatest inequalities. By protecting and improving maternal and early years health services for children to enable as many as possible to have the best start in life. Promoting healthy relationships, especially among young people. Maintaining a universal sexual health service with a digital element to ensure access for all. Continuing investment in other mandated services, including DAT and NHS health checks to protect health and prevent early deaths. Investing in projects and programs that will mitigate the negative mental health impacts of the COVID-19 pandemic and reduce the risk of suicide. And by promoting and increasing physical activity in everyday life, developing a culture where everyone feels able to get active in a way that's right for them. Thank you for listening. We hope you found this uplifting, and there is some time for some questions if members have them. And now you're on mute, Rob.
No questions? Type your X's in the box. Let's get going.
No, it's me that couldn't see.
Can I check with Sarah? Is anyone putting X's in the box, or we can't see anything?
No, that's fine. We have a question just come in the box from Councillor McLenning, followed by Councillor Mike Thomas.
Thank you for the presentation.
I can't see it, Sarah.
So Councillor McLenning is first.
Shall I go?
Yes, please.
When I first joined the council, and I remember Sally and I falling out on a comment I made about, do you remember that, Sally? We got on since then about judging Cornish people and their lifestyles. I've come across quite a bit more since I've been doing it for 4 years, and I still have concerns about benefits, whether they're going to the right people. because I get other people who don't get benefits, who are near to it, who don't get help, but they criticise lifestyles of people who perhaps drive cars, smoke heavy, got this, that and the other. And I get that quite regularly. Now, I've tried to work with Sally on this and give the benefit of the doubt. But moving on to my main question is that it seems like it's going to be a panacea of excellent work by you two there, what you put forward. I get confused about, I'm on Cornwall Housing, so we've done a job with Andrew Mitchell on the homeless. But in my division, I've had to go around and give people step change to join to sort out their debts. I've had to go out with other people at night into Foxhole and St Stephen's Recreation Ground to tell the kids to stop taking drugs, stop gambling, and don't cause any trouble. And they respect you if you say it how it is, because I've got experiences of all three. But I can't get hold of anybody. I have to badger the police to come out with a begging. So all this sounds wonderful, but is it at my fingertips as well? Because it always comes out the same places: Penzance. It's as though the K country is on the Thames at the Isle of Dogs. And I just get concerned, Rob and Sally, that we don't get a mention. Thank you.
So there's different bits there, aren't there? I mean, I guess what I'd want to reflect in terms of your opening comments is that the benefit system is not the council, so we don't hold responsibilities for that. What I would pick up on is you talked about helping people with debt, and I think we're going to see an awful lot more of that, unfortunately. And so we have programs like Money Matters through the Together for Family Services, which would be helping support people with debt. And I think that is important work that all councillors familiarise themselves with, because I think it's going to be very much part of the picture going forward. In terms of the issues about the community safety aspects, I'm sure that's you, Rob. There's always going to be a challenge with the areas that aren't part of the safer towns, I would have thought.
Yeah, I think there's a couple of things there. People who don't quite qualify for benefits, the squeezed middle, I think it was called at one point, and it's what I've got in my ward, where I've got the highest number of university degrees, the highest number of young couples just about getting by, and it's tricky for them. But we do what we can to support. The idea, I think you were driving at people criticising other people's lifestyles. I mean, that's been with us for a long time. In The Road to Wigan Pier, George Orwell was furious about a letter that was written in the Times saying, "Oh, these poor people, they shouldn't be going off buying fish and chips and eating jam sandwiches. They can live comfortably on vegetables for a week on that £1 a week they earn." And yet that's not what you want, is it? You've worked hard. You don't want necessarily. I don't want to find myself in a position where I'm criticising vegetarians, but you'd like a bag of fish and chips. But that's been with us for a long time and will continue. And I see Pauline Giles running online cookery courses to teach young people how to cook, because somehow we've managed to lose that. In our towns, we have some of the Helston isn't a safer town, and says, why can't we be a safer town? And we say, be grateful that you're not a safer town, because it's the areas that have high levels of drug abuse and alcohol abuse that are getting the attention. Once you move on to the villages, that gets really difficult, and it is just a resource issue as far as we're concerned. I absolutely accept what you say, that the couple of kids down the bus shelter, if they're just drinking cider, we've been there. But what's happening now is the county lines are extending across, and it's no longer just cider, it's all manner of drugs that were unimaginable in Cornwall 10 years ago. I wouldn't have known where to go to buy something 10 years ago, whereas during the next question I can pop out to Furness Island and get you whatever you want. It's ridiculous. And so those street drinkers, and I see young kids with them now being drawn into their orbit, and that's what we're paying attention to and focusing. We have a crack cocaine wave coming at us. Well, it's been saying it's coming at us for a while. It's actually here, and that stuff is available cheaply on the streets, and it's just not something we've dealt with in Cornwall in the past, but we really are gearing up. Simon Mould is here. Simon, do you want to come in and say something about that? Because I get out of my depth quickly.
Before he does, Rob, I think we'd also say that between us, we've spent a lot of time talking about young people and drugs, haven't we? And the drug piece in general, which is why we've worked so hard to not put in the reductions in the budget that were planned around that, because we could see those real needs there. So
it's very expensive. But I wonder, Simon, if you could comment on the differences between the towns and the villages, because it is a real issue.
Yeah, of course, and thank you, councillors, and thank you, Councillor McLennan. Absolutely, from my perspective, I think there's a couple of key points I'd probably like to just come back to. Firstly, as you quite rightly said, Councillor Nolan, we do have the 10 towns. They've come about by using the Morial analysis, so we take all of the intelligence that we gather from all of the different agencies to do a risk assessment to see where the highest level of activity is, so that we can put those pieces there. As in the update that Councillor Nolan gave earlier, you'll also note that we have also, as well as the Safer Towns, put together a toolkit which we'll be launching, and that will be going through to help ensure that other localities, so including the village areas that you've just referenced, also are able to draw on support and look on that toolkit to see what other help can be provided. Again, I would always look to encourage residents to be and businesses to be reporting any incidents of crime or disorder, either 999 if it's an emergency issue that they can see, or through 101, or email if it's a non-emergency. And I do appreciate that at times the response that might be gained isn't as speedy as that individual may require, but what it does do is it does enable us to see that significant intelligence picture build, and it enables us with our other agency partners to look at how best to respond to that, and where necessary, as we've seen in some of the towns more recently, increase the resource for a focused period of time. With regards to Councillor McLennan's perspective as well, obviously we also have the community safety officer that covers the area, as does ASB, and we've also got the outreach workers where we are with you, so we can always make sure that those can link across and see how we can support through that. So I think in short, we will always do what we can to where issues have been identified, and as we gather that intelligence, look at the most effective way in which we can put that resource to that piece for you. But we do need to make sure that that evidence is coming through, and we have been able to put those task and finishes in places like Lewes and Helston most recently. So I hope that provides the answer, Councillor Nolan.
Well, Simon, you know me quite well, and we've worked together on lots of things. I respect you. Just quickly, Chair, Rob, if I could just come back. Would it not be possible to put in place a random, your team going around at random times? Because I'm going to send you something about dog litter later, because someone sent me something from New Zealand, what they put up there, and don't muck around with their words, being posted on Facebook. And I think we're a bit soft on this subject. I've got 3 dogs, and we do it properly, and so many people do it properly. But there's lots of things, and it would be nice to see a random visit by your team on duty, if you like, is that the right word, from time to time. But anyway, thanks for everything, Simon, that you've tried to help me with, and Rob and Sally, thank you.
Thank you.
So while Rob's still on mute, Sarah, if you're able to, or can you see anything, Rob? Because my chat has completely disappeared, although I've just seen that I can write into it.
No, Sarah, who's next?
Yes, it's Councillor Thomas next. Councillor Mike Thomas.
Councillor Thomas.
Hi, I've just had the Windows blue screen of doom, so I'm on my phone. It does happen. It's all
good day for it, isn't it?
Yeah, fantastic. Thank you for the presentation, which has perhaps been more about the sort of safer towns issue. And it's interesting, Rob mentioned Helston. I didn't really want to talk about it, but we did go through this a few years ago, because I certainly raised this in neighbourhoods, the issue of the 10 towns, and I got the feeling certainly from talking to Erica and Tamsin that they recognised that towns like Helston and Camelford did suffer from this labelling. There are unintended consequences. I mean, the town council, for example, in Helston got into trouble by the local free paper because it was accused of not applying for safer town status. So there's a problem, the unintended consequences of that, which can be quite significant. But they came and spoke to the town council and they understood the issues and we have moved on a bit. But there is still a sort of issue there that sort of Mike has hinted similar in his area, which does concern me about sort of access to resources. But I really don't want to labour that. I was hoping that perhaps the presentation might have focused a little bit more on the Healthy Cornwall in terms of the success or the workings of the family partnerships and the importance, in my mind, of working with the National Health Service for some more pilots with social prescribing. In my opinion, there isn't enough budget there for social prescribers to actually spend. And also, the big concern for me is the state of our leisure centres and sport and leisure centres and whether they're going to survive the next few months. Because in my opinion, I know Sally and I slightly disagree on this in terms of the use of sports and leisure centres. I'm of the opinion there should be a seamless movement between the doctor's surgery and the leisure sports centre. And I know that there's certainly on the Health and Wellbeing Board, there are quite a few people who think the same way. And I do think as a council, we should be promoting far more than we are when we can, the use of our sports centres. So really, my question there is about celebrating or perhaps commenting on family partnerships and the hubs, the Carrier one that I'm a member of, and also whether there's a scope for more pilots with the National Health Service regarding social prescribing.
Thank you, Councillor Thomas. So you'll be thrilled to know that there is another all-member briefing coming up later, which would focus on all things to do with children and young people in particular, the Together for Families element of work, in which I will ensure that there is something particularly about family partnerships, because I would agree with you. I think that they're a really strong part of the work that we do. So more on that later. So social prescribing, I'm not going to disagree with you. It's a really valuable way for members of the public who might not know what we're talking about. This is where you might suggest involvement in local activities of all different shapes and sizes. That might be a walking group, it might be a knitting group, it might be art therapy, all sorts of ways in which you could link in with something that feels in tune to what your personal needs might be, is shown to be more effective in some ways than medicating people. So that whole social prescribing thing, absolutely big supporter of that, Councillor Thomas. Thank you for raising it, and we've done what we can with different bits of funding that have been available, and it's absolutely something that we want to continue to support in every way that we can. And similarly, I think on the leisure centres, I think the bit that we've said, the conversation we've had before in those health boards that you mentioned, is that my point is always that healthy activity doesn't have to involve any particular physical outlay. Councillor Nolan was out at, well, I don't know, some extremely early hour of the morning, jogging. And
yes,
and that didn't cost him a penny to do so. He did, well, apart from the trainers and the funny hat he seems to have worn, but he just could get out and do it. So I'm always wanting to promote and support those things that any of us can do at any time. And goodness me, in this lockdown, we've really had to think like that. I felt it very keenly when the swimming pools opened. I was there early in the morning. I thought the COVID secure operation was absolutely fantastic, and it was really, really helpful for me to be able to go and do that swim before doing anything else. And then it stopped because we went into another lockdown. And you feel that very keenly. It's an ideal scenario to have as much choice of activities as possible, as limited cost as possible. All of that is very important. So I know we'll be working with GLL over the holidays and activities programme for children and young people, which is part of that government funding for helping provide food and activities during the Easter, summer, Christmas holidays that are coming up. We'll be working with Active Cornwall and GLL to try and make sure that we're using those facilities to the best of our abilities. I don't actually disagree with you on any of those points that provision is an important part of our armoury. I think just my point would always be that we need to make sure we have a wide option, and for anybody who feels they couldn't exercise because they're not next to a leisure centre, there are other things that they can do. So it's making sure that there's a suite of activities, but absolutely some good points raised there. Thank you.
Thank you. Thank you for your answers.
On the 29th of March, we can get back to outdoor sports. The young kids can go and play football. Organised outdoor sports will be allowed again in the parks. It'll be great to see them back doing that. Yes, but it's not until the 12th of April the gyms can reopen, and I know we're in discussion right now with GL about how that is going to work.
I shall be there. Thank you.
Sarah, you'll have to tell us who's next.
Yes, indeed. Councillor Jenkin is next.
Councillor Jenkin.
Councillor Jenkin, can you hear me? Did you want to pose a question?
Do you want to move on, Sarah? Is there anybody else?
Yes, and Councillor Ian Thomas had made a comment, and I don't know whether he would like to pose you a question around his comment. Councillor Ian Thomas.
No, it wasn't a question. It was an observation that one of the slides that Rob spoke to, it mentions the 10 safer towns, and it finishes by mentioning them, and it seems to suggest that Redruth has been subsumed by Penzance, because it says and Redruth, Penzance, where of course it means Redruth and Penzance. Thank you.
Sorry.
So just back to Councillor Jenkin, Loveday Jenkin. Can you hear me, Loveday? Did you want to ask a question? I don't think she's on the call anymore, Rob.
Okay. Anybody else?
Not as far as I can see, unless any members who can't see the chat box because of the upgrade like to put their hand up if they wish to ask a question.
Oh, lovely. Well, there you are. You can all get out and go for a
walk. As far as
walk.
I can see, no more questions, Councillor Nolan.
Excellent. Well, thank you very much, members, for attending. And we can all go and get out for a walk now. It's a lovely day, and lovely dry weekend. We'll all be quite pleased not to have any rain, I think. Yes. Anyway, thank you very much. We'll see you at the next briefing.
Thank you
very much.
Thanks, Rob.
Thank you.
Thanks both.
Thank you.